Right, I will get started right now. So again, thank you guys so much for joining today, our HIE office hours. Today, we're going to do a session on Mythbusters. So just talk a little bit about maybe misconceptions and set the record straight. So we'll get going. A few things for our office hours. As you know, our panelists, we are all muted during this session. Attendees are automatically muted. So if you need to speak, please utilize the raise hand function, and then a host can unmute you for a question. You can also use the Q&A function in your bar and ask questions that way. The presentation slide deck will be provided in an email following the session. And today and past sessions are available on the My Health website under resources and HIE office hours. So reminders, we are doing this not only for current My Health members if they want more education, but also as a promotion of the OK Shine Connection Fee Assistant Program that's going on right now. This is an opportunity for any organization that employs licensed healthcare providers in the state of Oklahoma to sign up for this connection fee assistance for their some of their program fees to be covered by state tax dollars. So it does cover one-time fees from My Health. So My Health usually has to make a charge to the organization, but those are covered by this program. And to get providers connected to the state HIE. And then there's other related HIE fees that can be considered covered. So right now, also your EHR will charge a fee to connect to the HIE, and there's forms that you can fill out to get that covered as well. Please go to okshine.gov to find more information and to sign up for this. You're not promised or guaranteed anything, meaning you can sign up and just get more information from us, and then we can go from there. And if you decide to move forward, there's no harm or no foul. There is a Sooner Select Provider Incentive Program that's very important because if we ever have a fee and something costs, we would like an incentive or a program to offset those costs. So there is one available. You can be eligible for up to a 9.5% increase for Medicaid providers who participate in My Health. There is a guaranteed 18.5% increase, but that 9.5% is extra due to being a My Health member and both sending and utilizing the HIE. So to complete your My Health application, again, that's just sending My Health information, and someone from My Health or OFMQ will reach out to you and begin the process, the order form process of becoming a My Health member. If you have any questions, please reach out. You can ask a question in the Q&A, or we can even set up a call. We'd love to talk to you. So today is kind of going to be a fun one. It is going to be our HIE myths. We're going to see if they are busted or they are confirmed. So it should be a fun one. So first off, we're going to start off with myth 1. Every healthcare provider in Oklahoma participates in the HIE due to state legislation. So is that a myth or a fact or confirmed? And that is in fact a myth, and it is busted. So while legislation initially did mandate participation of the HIE, the emergency rule that was passed in July 2023 allowed for a provider to register for an exemption, and it was automatically granted. So providers can choose to be exempted from transmitting data to or utilizing data or both to the state HIE. Another thing to keep in mind is if you have applied for that exemption, that does not prevent you from deciding to now join the HIE. So you do not have to do it due to state legislation. It is just highly suggested due to more well-rounded care coordination of care, but you do not have to. Myth 2. The HIE is governed solely by the Oklahoma Healthcare Authority. That is false. The Healthcare Authority, the HIE is a stakeholder governed. They are stakeholder governed. So My Health Access Network has a stakeholder governed board, and they ensure that multiple voices within the healthcare community contribute to its operations and oversight. So in fact, My Health is the HIE right now. They do get funding from the Healthcare Authority and the funding that I talked about previously, but MyHealth is stakeholder governed. They have a board, and people that sit on the board have a stake in MyHealth, and they help make the decisions to make sure everything stays in line with the needs, the privacy, and the healthcare community's concerns. Myth number 3. Patients have no control over their data being shared through the HIE. Busted. So patients retain control over their data. In fact, the HIE does not own the data. That data is just shared for coordination purposes. The health systems, healthcare organizations own the data that is shared with the HIE. They have the right, meaning patients have the right to opt out and prevent disclosure of their data. Additionally, mental health data requires an explicit affirmative consent to be shared. So there are many privacy rules. There are many rules that the HIE and MyHealth has that governs how data is shared. And just so you know, patients do have control of their data and they can opt out of being in the HIE. Myth number 4. A provider can access a patient's health data if they are actively being treated by a healthcare provider within the network. And that is confirmed. That is true. The HIE is meant to be a resource for healthcare providers. So providers must have an active treatment relationship with the patient and attest to this at the time of access, ensuring that data is accessed properly. So when you are taking care of a patient in your setting of care, and you're taking care of a patient named Lindsey Wiley, and you want to access the HIE, you're going to type in Lindsey Wiley, or you're going to use the single sign-on button to get signed on to look at Lindsey Wiley's chart. A pop-up's going to come up that says, yes, I am treating this patient. So you're going to click yes. That is just attesting that you're not looking up someone for inappropriate reasons. But yes, you can absolutely look at this, and multiple people can look at the same chart at one time. Myth 5. Providers are charged the same participation fees regardless of their size. Busted. So there are different fees that MyHealth does charge. Participation fees with MyHealth vary based on the size and type of organization, making the cost structure adaptable to different provider needs. So there is a per provider fee per month for like a healthcare outpatient setting. So that is a fee you will pay monthly, but it is a very reasonable fee. And then there's fees that are different, calculated different for like hospitals and even long-term care facilities. So there is a fee, and those are not covered by the connection fee assistance. However, your connection fees from both MyHealth and from your EHR are covered through this process. And then there's an incentive program that many people, many Medicaid providers can get enough incentive that will more than pay for their costs that they have to pay MyHealth. So you'll in fact end up on top and in the green. Myth number 6. Connection fees to join the HIE can be covered through assistance programs. I might have just spilled the beans on this one. So that is confirmed. So the connection fee assistance program is available to help providers cover those one-time fees, reducing the financial burden to participate. So as you guys know, the HIE has been around for a long time, and we've heard what the barriers are. And the barriers often were the fees that were charged by MyHealth, because they have staff that have to work on the integration to get you connected. And then there's fees that your EHR vendor charges as well. And those fees often were a barrier, a financial barrier for people to join the HIE. That is what this connection fee assistance program is for. It is available only for a limited time. So we hope that you can sign up on this program and take advantage of it while it's still available. But those fees are being eliminated. So then the only fees, and I say only with an asterisk because I don't know exactly if your EHR charges you monthly fees, but from MyHealth, you will have that monthly fee that you have to pay, whether it's a per provider or a per admission charge based on average daily census, but that's what you would have to pay, and that's it. And then again, your incentive could offset those costs. Myth number 7. The HIE prevents adverse drug events by providing medication allergy information to providers. And that is correct. By providing real-time access to medication allergy data, the HIE helps reduce errors and prevent adverse drug events. So of course, think of the patients that have many chronic conditions. They're on many different medications. Every time they go to the doctor, the ER, in a hospital, they're asked their list of drugs. If they're at a different facility that it's not already in that EHR, the HIE is so valuable because you could pull that up. You can look at their list of drugs. You can look at their medication allergies and perhaps prevent an adverse drug event. So it is very useful. And oftentimes patients might know what medications they're on, but might not know the dosage. And that's hard too, because you want that data correct in your system. And that's what the HIE can help for. And ultimately, it is to make sure we do not have an adverse drug event for the patient. Myth number 8. Only providers within urban areas of Oklahoma can benefit from the HIE. Is that a fact or a myth? Well, busted. Of course, that is a myth. The HIE benefits providers across urban and rural areas. And we've shown before the map that shows the coverage in Oklahoma, and it is very dense. Most patients' data is in the HIE across the state. We have all the major healthcare systems in Oklahoma. I believe there's 7 major healthcare systems in Oklahoma. All of them are contributing data. I think over 95% of hospitals in the state are contributing data. And we're working on long-term care facilities and then, of course, primary care and specialty providers. So it is huge across the state. So even the rural areas can benefit, and that might be where they need it the most, because it might be smaller health systems that are connected and can utilize that, and then they'll get the data from the big, more urban areas. So once again, the HIE benefits providers across both urban and rural areas, really bridging the gap of care coordination and improving healthcare across the state. We want to have the most access possible to increase efficiency and the quality of care provided really across all settings of care. Myth number 9. The HIE is designed to support compliance with state and federal interoperability rules. Well, of course, that is absolutely fact, and that is confirmed. The HIE does align with CMS interoperability rules and other regulations, ensuring compliance while enhancing healthcare data exchange. So there are federal rules that we have to follow as an HIE. We follow those rules. We have compliance with both HIPAA and other NIST type standards to make sure we are private and secure. We also, there's interoperability rules that we have to have. And then of course there's value-based payment programs that you can do. And My Health is very good and even working to be more compatible with those value-based payment programs that are either required, and if you don't do, you could lose money, or that can help provide your organization an incentive. Myth 10, patients cannot opt back into the HIE once they've opted out. Well, of course, that's not true. So you can opt out. Maybe you opt out for a certain reason, but patients who previously opted out can absolutely change their preference and opt back in if they choose. So if someone is scared about their information being shared, they can, of course, opt out. But in the event that they maybe see that it would be beneficial, maybe they're visiting more providers and they're giving their list of medications, they can opt back in and their data can be shared. Because keep in mind, data is only shared and available to people that are treating you. It is not out in the open for every provider in Oklahoma. That would be a violation of privacy. It is only available to those providers and staff that are treating you and in your treatment of care. Myth number 11. The HIE increases healthcare costs for providers by adding additional layers of technology. Well, of course, this is not true. This myth is in fact busted. The HIE actually reduces cost by preventing duplicative is what I was trying to say, testing, improving care coordination, and lowering administrative burden. So there's actually many things that help the return on investment actually will increase for you. And I just mentioned stuff here. There's a cost measure for promoting interoperability and MIPS, for MIPS. And a lot of those things go against. If you're utilizing more tests than another provider that's similar to you in a similar location, in other words, duplicative testing, your cost score is going to go down and your score is going to go down and your incentive is going to go down. Okay. Improving care coordination. Many small facilities don't have a care coordinating nurse, or they're spending a lot of time after hours or during lunch breaks tracking down lab results, radiology results. And if you can just log in and see those right away, that is going to actually reduce the burden of your staff and make it quicker and easier, costing less money. And then again, administrative burdens as well. So you might have people that need information for insurance information, for billing purposes, coding, that will be in there and can be helpful as well. Myth 12. The HIE in Oklahoma only applies to Medicaid providers. So this is a Medicaid program that I've been talking about. So is the HIE only available for Medicaid providers? And is that all we're pushing right now? Absolutely not. That is in fact a busted myth. The HIE applies to all participating healthcare providers in the state of Oklahoma, not just serving Medicaid patients, broadening its application and its impact across the healthcare system. So we are available for all payers, all providers in the state, and that's who we serve, because the idea is to have all types of patients in there, not just one insurer being Medicaid. So it is available for all. Now, the incentive that's available right now is just for Medicaid providers. However, if you are a MyHealth member and you are just a Medicare provider and you're doing promoting interoperability, there are ways that MyHealth can help you meet certain measures to make your score go up so you can get a higher incentive with that program. Quality measures, if you're looking for preventative care measures or other chronic disease measures to help your data maybe in an ACO, MyHealth can help, and that can help your incentive that way. So there's many ways MyHealth can improve your quality scores and your data even more than just care coordination, and that is available to all providers. Myth 13. I don't have time to look at another electronic system for patient care. So oftentimes you'll hear that. I just don't have time for it. I can't learn something else. I don't want another system to log into, right? Well, of course, I stand behind this. MyHealth OFMQ stands behind this, but it is our job to help you integrate this into your system so you realize that it is in fact will reduce a burden on your workflow and your daily activities. MyHealth also offers single sign-on option. It is in testing right now, but it is something that's coming soon for all. So that would mean if you're in your EHR and we can get single sign-on implemented with your EHR, when you're in a chart like Lindsey Wiley's chart, you will click the HIE button and it would take you directly to Lindsey Wiley's chart in the HIE. So it is seamless. You don't have to click another screen, log in, remember a password, that kind of thing. Right now, that's what you do. And we still think that's helpful and can help you integrate that into your system. However, the single sign-on option is going to be very seamless and transition you straight to your patient's HIE chart so you can look at what you need to and then go straight back. So we really think it actually will reduce a burden and help you have the data at your fingertips at the time that you're seeing patients in your clinic or hospital setting. Myth 14. Anyone can access the HIE. That is not true. Only healthcare professionals can access the HIE. And so what this means is what I talked about earlier. Only healthcare professionals that are involved in the patient's care and are authorized to view a patient record. So of course, HIPAA is abided by. You still have to follow the HIPAA standards. These healthcare providers could be doctors, nurses, hospital clinicians, dietitians, diagnostic staff, behavioral health, mental health providers, pharmacists. It could even be administrative staff. So there's many administrative staff like billers, insurers that can have access to the data, coders that need it for billing and administrative purposes. But you cannot just look up anything. Everything is tracked. It would be the same rules that apply to your EHR. So just know that the same individuals who can use your record in your health system or your clinic or your long-term care facility are the same that would have access here. So it is not available to everyone. It is in fact secure and you have to be authorized to use it. And you're the one who determines that authorization. And then of course you'll have the same practices of viewing lists to make sure no one's viewing charts they shouldn't look at. Myth 15. All behavioral health notes are shared in the HIE. That is not true. There are laws such as psychotherapy notes. They are excluded from transmission to the HIE, as well as any behavioral health data covered by 42 CFR 0.2. So do know that there are laws and regulations. That's why My Health is governed. We have many committees that make sure that everything is secure and regulated. So not all notes are automatically shared. So everything is very secure and available to those who need it and those who don't. And then of course there's opt-out measures. There's an exclusions for providers if they don't want to participate that we talked about in the beginning. And then there's also exclusions for patients, and you can always be excluded and then opt back in. So those are all available for use. All right. I went through these kind of quickly. We had 15 myths today. What questions do we have? I hope this was helpful. I'm looking in the chat to see if I see anything. And right now I do not see anything in the chat. Do we have any questions or comments? As always, if you guys have questions, I'm going to share my information. Here's my contact information. Please email me if you guys have questions or other ideas for more Mythbusters. We would be happy to add those. We do have a Q&A session and FAQs posted on the My Health website. So those are available as well. And this is something that we're trying to do. Just any misconceptions about the HIE, we want to clear up the facts and make sure people know what's available and what's true and what's not. And that's it. Does anybody have any questions? All right. Well, this one was a kind of quick one today. It only took about, looked like about 20, 25 minutes. So we thank you guys so much for joining. If you have any ideas of other information you'd like us to share, we love that. I do have a question coming in from Melissa. Thank you, Melissa. It says, do pharmacists participate? And absolutely. We are recruiting pharmacists. We think it would be good for them to have access and they can participate. And I believe we have some that do currently participate. Same thing, we're doing a big behavioral health and mental health, therapists, dietitians. So a lot of those specialties also can participate. Some of them are even eligible for the incentive. But yes, we are trying to get data from across the board. Even insurance companies share information. So the idea would be very inclusive of everything, including medications, pharmacy information. So great question. Thank you. Another thing to think about, this isn't only, it's not only primary care information. So over 70% of Oklahomans have their data in the HIE right now. And it's actually probably more, have their data in more than one healthcare system. So you might go to a primary care, like me, I feel like I'm pretty healthy. I shouldn't have much data in many places. However, I've gone to Integris, I go to my PCP, I've gone to urgent care. You know, I've had other procedures done at other locations throughout my life. So at the end of the day, I do have a lot of healthcare data in different places. So it is possible to be in other locations. And that's why, since my data is in so many places, the whole point is it would all be in one location for my provider moving forward. Another question came in as a therapist. How do you know what % increase you're eligible for? So the good thing is the slide that I have at the beginning where we say to sign up for the connection fee assistance program and for the My Health order form. If you do that, we have access to some data to see if you would be eligible for an incentive. I don't have that available now, but there is data that OFMQ and My Health have access to. So we'd be able to look you up to see if you would have gotten an incentive for Q1 or Q2. So please sign up for those or send an email and we can get you that information because that is very useful. If you know that you've missed out on hundreds, maybe even thousands of dollars, that would have offset the cost. You'd have now access to this wonderful data, and you'd even be making some incentive money. So great question. Another thing to talk about is My Health is not the only state, or OFMQ is not the only state in the country that has an HIE. Actually, all 50 states are working towards an HIE, and then they will be, they can share data too across HIEs, so across state lines. Oklahoma is one of the most densely populated states in the country, so we should be really proud of the work that My Health in our state has done. But all states are working on this. Another question came in, does the increase come quarterly, separate, or per service, or weekly? So it does come quarterly. These incentive payments are quarterly. They'll come from one of the managed care companies. So it's a little confusing because what happens is the incentive is paid from Medicaid or from Oklahoma Healthcare Authority to one of the 3 or 4 managed, I think it's just the 3 managed care companies. They get the lump sum and they have to pay it out. So it will not come straight from the healthcare authority. It will come from one of your Medicaid payers or managed care organizations. But that is a quarterly payment. So we'd be able to provide you quarterly stats on maybe what possibly your incentive could be. Great questions. All right. Is there anything else? If not, I thank you guys so much for joining. We will get you more information soon on when our next HIE office hours will be. We're going to focus a lot on the benefits of an HIE, the different applications, the different considerations for HIE and how to integrate it into your workflow. And we'll have many things coming for in next quarter come the first of the year. So thank you guys so much. We hope that you will reach out and get signed up and we can answer any more questions that you have. Thank you so much, and we appreciate your time. Bye, guys.